welcome back to my channel. My name is Gia. I'm your friendly family nurse practitioner. So today I'm going to talk about how to help you navigate when your patients come in with a laundry list. Yes, a long list of complaints.
So, my goal when I see a patient is simple: to help them. Every interaction begins with this sincere intention, whether it's easing their symptoms, addressing their concerns, or guiding them toward better health. I approach each visit with a genuine desire to make a positive impact in their lives.
However, it's not always easy when a patient arrives with a laundry list of issues or concerns or symptoms. While I want to help them as much as possible, I want to help this patient as much as possible, and I know you do too, but addressing every item on their list isn't practical. Why? Because it can lead to rushing. You will rush through each concern, which can lead to forgetting important details, right? And also, you don't want to bombard your patients with multiple recommendations, multiple medications, or like telling them to do a lot of diagnostic testing because they brought up a lot of symptoms for that visit. And then this can lead them to feel overwhelmed, as well as it can also lead to extended visits, which can lead you to extended documentation and can eventually lead to burnout. Does that make sense?
So, a few months back, I encountered a patient who came in seeking a follow up appointment. So, his complaint was just for follow up. Upon reviewing his chart, I realized he hadn't been seen for over 2 years. And surprisingly, not really, he wanted to follow up on everything from medication refills to addressing multiple symptoms and even explanation for previous lab results.
In the past, this situation would have overwhelmed me, but with time, I have learned how to approach it differently. By truly listening to him and understanding his agenda upfront, I was able to acknowledge his priorities and preferences, and this allowed me to align my approach with his needs and goals more effectively. Though I couldn't address all of his concern because of the limited time that we had, I was able to focus on the three most important things or concerns that we both agreed upon. And I explained to him that I had only about 15 minutes for the appointment, and if I had more time, I would have been able to address all of his concerns. But he understood, and our visit went smoothly.
When a patient arrives with a long list of concerns, it's important to acknowledge their list while also explaining that we'll address as much as possible within the allocated time for the visit. And this shows respect for their time, our time, and that of other patients. Asking them to identify the top three issues they want to discuss today allows us to prioritize efficiently. Does that make sense? And it's also important to check their list, as their priorities may differ from ours. For instance, unilateral leg swelling and pain should be one of the top priorities, right?
So here's another tip I learned from a class that I had attended um, in the past. You can also gently ask your patient, this question: in the next 15 minutes, which top three concerns or symptoms would you like to discuss today? And I have used this statement or approach myself, and it has helped me, and it has worked well for me for the most part. And it all comes down to how you deliver it, though. You don't want to sound that you are rushing. You don't want to sound rushed, but it is also important to let your patients know that you only had, a little bit of time. You had a set amount of time for each appointment. And another approach I use is to clarify any other hidden complaints in the beginning of the visit, right? Sometimes patient will just tell the MA that they're only here for, let's say, for example, dry skin or back pain, but they actually have other complaints, and they are afraid to tell your medical assistant. So in this, in this scenario, you can say something like, okay, I understand that you are here for knee pain. Is there anything else you'd like me to discuss today so we can make the most of our time together? And I also add in, remember, our visits is only 15 minutes, so I want to ensure we cover any important concerns. And this way, you are clear about your time limit while also ensuring that you address some other concerns effectively. We may not, or I may not, or you may not be able to address everything, but at least you covered most of it or touch some of the concerns. And don't be afraid to ask them to make another appointment if they had any other concerns that were not concerning, like symptoms that can wait for another 2 weeks, for another month, so that way the patient will know that you care about them by setting the appointment ahead of time. And I always ask them nicely and don't feel like you just want to get rid of them. Does that make sense?
Remember, when your intention is genuinely to help your patients, it shines through. And most of the time, patients are understanding of your time constraints and appreciate your effort to prioritize their concerns.
Now, do these approaches or techniques work perfectly or every time? Certainly not. However, the idea is to prioritize your patient's pressing or most concerning symptoms while balancing our obligations to others. Remember, we have other patients too. It's about doing our best within the constraints of time and resources. While some patients may not fully understand, it's important to remember our duty to all of our patients, not just one. Does that make sense? Okay, by focusing on what's most important and managing expectations, we can provide the best possible care to everyone under our care efficiently. Okay? I hope you found this video helpful. Remember, I am your friend and mentor, and if you have not done so, please subscribe to my channel. If you have any concerns about how to effectively manage your patient expectations, please leave it in the comment section, and bye for now.